Next conversation is around transgender people and the struggles that they're facing in accessing health services in South Africa. So for those that aren't particularly sure what a transgender person is, please explain.
So a transgender person is someone who was born with a sex and their gender identity is different from that sex. So for instance, you might be born with a vagina and then as life moves on, you identify as a male later in life. Or you might not identify as male or female, as a combination of it, and be non-binary. Now some transgender people may undergo medical treatments to make their bodies a little bit more congruent with their gender identity. So if you, for instance, a trans woman, in other words, someone who was born with male genitalia and then has developed a gender identity of a woman, then you may need hair removal treatments or hormone therapy to make your voice a little bit, on your chest, a little bit more feminine, and you might, for instance, also need breast surgery. So when transgender people access such services, they really experience huge amounts of discrimination and also prejudice from health workers. And today we're going to talk to Zoey Black from Cape Town, and she is a trans woman and also a trans activist, to talk to us about her experience of gender affirmative care. In other words, surgery and hormone therapy that would help her body to be more congruent to her gender identity. We have Zoey Black on the line now. Zoey, thank you very much for joining us and for your courage to share your story with us today.
Good morning. Thank you so much for having me.
You are undergoing gender affirmative care. What does that entail?
So for trans people, that means effectively using medical care to affirm ourselves in our identities. And so for trans people, there are a number of options and medical care, the treatments available. And so these things may involve things like hormonal care. They may involve things like surgeries. For me, myself, I have been on hormone care for a number of years now. And I am looking to go and attempt to get some surgery done, because that is something that I feel I need to affirm myself in my identity.
Zoey, I've watched your videos on YouTube where you explain that you now would like to have breast surgery or care, and that you would have to pay in cash for this at private sector facilities, because in the public sector this type of care is not that available. Tell us a bit more about it.
Okay, so I was in the public healthcare system for quite a while, and that was a difficult experience, to kind of put it mildly. In this country, we only have 2 state facilities that provide trans people with both hormonal care and surgical care. And so if you are wanting to get surgery specifically through the state, that waiting list is 25 years. So if I were to do this through the state, I would only be able to get this in my maybe 50s or 60s. And so these speak to how the resources are allocated and how resources are distributed for trans people. So medical aids in this country also do not cover any kind of gender affirming care at all. So trans people are left on their own to kind of figure things out. And so for me, what that meant was that I had to find the funds myself. So I'm in the process of crowdfunding for it, because 1, the medical aids won't cover it, and 2, the state, there aren't enough resources in the state to be able to provide that sort of care for trans people. The waiting lists are extraordinary in these state facilities, and it just seems like nothing has been moving for the longest time, and so there is a problem. And so the questions then are, I guess, for the healthcare sector, how do they then provide that kind of care, but particularly surgeries for trans people in South Africa?
So you've now spoken about the financial implications and also that it's hard to access such services specifically in the public sector. But when you do access it, what kinds of discrimination have you experienced?
I think to maybe just talk about it just a little bit generally very quickly. The trans people face extraordinary discrimination in this country globally. There was a study that was done in the US a couple of years ago that found the average lifespan of trans women of color to be 35 years. And that is the kind of day-to-day violence that we are facing. And so to get it more specific around my experience in the healthcare sector, it was extraordinarily difficult. From people doing, kind of double takes and kind of wanting to probe your body, kind of wanting to frame you in a way that there's something wrong with you, that you're not allowed to access this particular service, that you're not allowed to go into these particular spaces. Those are kind of very, not to trivialize them in any kind of way, but these are just the day-to-day things that we experience all the time on a day-to-day basis. And so there's a lot of work that needs to be done in the public healthcare system. I know Grooteskier Hospital has had a number of training, and they have a specific unit that works with trans people to provide these services and provide them in an affirming way. But there is still an incredible amount of work to be done with these healthcare workers in order to bring them in alignment in terms of the values and the jobs that they and the services that they're providing. It has been very, very difficult.
I'm unfortunately going to have to interrupt you there. We really appreciate you pointing out the discrimination against trans people in South Africa, and also that our health services need to change. That was Zoey Black. She is a trans rights activist and a filmmaker with Iranti, an LGBTQI+ advocacy organization for trans people.